good morning to everyone, and thank you for joining us. If it's the afternoon where you are, which is very well the case in Kenya, good afternoon to you as well. So welcome to another one of our webinars. We're really happy that you've joined us today. Um, at Hollard, we don't just look to provide you great health insurance. We're also really committed to giving you, our members, the information and insights and tools you need to take control of your health and well-being. That's why we're doing these webinars, and that's why they are so important to us, because they don't only give us an opportunity to share knowledge, but they also allow us to demonstrate our dedication to being thought leaders in the health and wellness industry. So let's just get started with the webinar. You'll notice that there will be poll questions popping up at the start and the end of the webinar. Please do complete these. It gives us great insights into what you're experiencing as the listener, as well as how we need to do certain things going forward. There's going to be Q&A session at the end, so please do stay online for that. You'll be able to type your questions or ask them in person. Just want to remind you, it has said so a few times that this session is being recorded. If you do have a problem with being in a session that's being recorded, you're welcome to leave, and then you'll be able to watch the recording at a later stage. So without further delay, let's get started. Our doctor, her whole bio was up on the screen, so I don't want to waste any more time just reading that back to you. But suffices to say, she's a proper expert in her field, and we really look forward to hearing her knowledge and her insights. Thanks, everybody. Enjoy.
Oh, thank you, Leanne, for that introduction, and good morning, good afternoon, good evening to you all, wherever you are. It is my great pleasure and privilege to be chatting to you today about insights into stress, which is something that we all deal with every day, and certainly insights into hormonal balances in women, which is a topic that I feel has been under-discussed for decades and decades, and it's high time, and it's good to see that it's garnering more discussion on public platforms. And I'm really excited to share some insights with you all today in the hope that it can help you to really approach your health in a very proactive way. I really love what Leanne said about health empowerment, how it is a process. It should be a proactive thing. We shouldn't be sitting back and living life and waiting for this concept of health or disease to happen to us. It's like a canvas that we choose to paint every single day. And we can really truly paint beautiful health canvases for ourselves. But I'm a great believer that we need the tools to be able to do so. So we've got to know what it is that we're trying to create, what health actually means for us, and how to navigate some of the challenges that we're faced with. So welcome to this morning's presentation. So we're going to really chat about stress and hormonal imbalance. Let's start with the concept of what is a hormone. So hormones in the physiology of the body and the physicality of the body are really just little chemical messengers that are being made and produced all the time, and they carry very important messages. And they basically control the function of every single thing you can imagine in the body. So hormones are the messengers of life, but our symptoms are in fact the messages that we need to listen to. Our symptoms are the messages, our hormones are the messengers, and the challenge is, are you listening to your body? And if you are, do you even know what the messages mean? So I'm a great fan of this idea called health literacy, which is understanding what health really means to us. There are different spheres of health. There's physical health, there's mental health, there's occupational health when you're at work, there's health in terms of our relationships. And we all have very different definitions around what health means to us. So tune in and always have a listen. Today we're going to speak more about the messages around women's hormones and stress. So how do these glorious hormones work? It's a fascinating, intricate system, really. But what I really want us to understand this morning is that we have all sorts of tissues in the body, all sorts of glands in the body that make different hormones. We've got the adrenal glands, which make stress hormones. We've got our ovaries, which make our female hormones, estrogen and progesterone, and so forth and so on. And I like to sort of think of these glands in the body as like the team. We've got all these different glands making different kinds of hormones, and together they form a team, or we could say a kind of orchestra, where beautiful and balanced hormone production is the key, balanced messaging between the different systems. But it's all really under control from the brain. That's where it all starts. So in the brain, we have something called a hypothalamus, which I always feel is like the CEO. If you think about your company and how it's structured, you've got your CEO right at the top. And the CEO, the hypothalamus, is the part of the brain that's getting input from the environment. So, for example, if a lion is running after us and trying to eat us, that's quite a big, serious threat. The CEO part of your brain is the first thing that's going to go, oh, I'm under threat. There's a problem. I need to do something about it. And it will send a message then to the pituitary gland, which also lives in the brain. And the pituitary gland is like a control room. If you kind of imagine Houston Control, that, controls all the NASA rockets, there's a whole bunch of coordination and communication going on there. And what really happens is the CEO, the hypothalamus, says to the control room, we've got a problem, alert, there's a lion coming to eat us. We need a response. And the pituitary gland's job is then to deploy a coordinated and appropriate response. So, for example, the pituitary gland will tell the adrenals, we need some cortisol, we need some stress response here. This is an alarming situation. We need to run. We need fuel for our muscles to run. We need more oxygen in the lungs to breathe to escape this lion. And at the same time, it's so intelligent and clever because it will also send a message to the other glands, like the ovaries, which are not needed in such a time. So if you think about the actual threat of a lion running after you, for example, and your life is at stake, it's certainly not the time to get all sexy and cuddly and making babies. So in this way, the brain is super intelligent and is shutting off the hormones that we don't need and switching on the hormones that we do need. And the significance of this, and I've lost my screen again, is really as we explore how stress affects female hormones, we understand clearly that stress can impact a woman's fertility, her ability to ovulate, her ability to fall pregnant. And as we're going to explore in the presentation today, stress directly can impact the level of vital female hormones like estrogen and progesterone. Okay. So again, this picture, not to spend too much time, but it's really just to get across this idea that there's a hormone symphony at play in your body. It's a delicate, beautiful symphony when it plays in tune, but when one of the instruments is off key or out of balance, it's going to affect the entire symphony. So in this way, if our stress response system and the way we make stress hormones like cortisol is out of balance or off key, we're going to see ripple effects into the rest of the body, not just the other hormones in the body, but other systems in the body. So, for example, cortisol and the immune system are really, really connected. And you guys would probably relate to this because you can think of times where you've been, really stressed at work, and then you tend to get colds and flus far more often. And this is because a very high cortisol level will dampen down the immune system and will make us more vulnerable to colds and flus. So understanding your stress response is vital. The first thing to understand about stress is that we get short-term stress and we get long-term stress. And it's really important to understand the difference because in the short-term stress can be quite a healthy response. We need it. We need it to function. We need it to perform. We need it to heal. So for example, if I cut my hand, the tissue around that little cut is going to get very red and swollen and inflamed. I'm going to make a bit of cortisol. This is going to help my healing in the short term, which I really, really want and really need. But there's got to be an end point because if this response goes on and on and on in the long term, it's no longer going to be healing. It's no longer going to serve me. And in fact, it can become quite damaging, which is what we're going to explore today. So short-term stress, not necessarily a bad thing. We need it. It serves its purpose and place. But if our stress response goes wonky over months to years, there can be really, really real health consequences. And as I mentioned, the health consequences are a whole bunch of ripple effects in other hormone tissues, like the thyroid, like the insulin levels. We see a lot of insulin resistance and weight gain and vulnerability to heart disease in very stressed people, but also in the very function of our cells, which can't function well in environments of high stress. As described earlier, we have quite a strong connection between the immune system and stress. And I mentioned to you that when cortisol is very, very high, we can have quite a lowered or dampened down immune system, getting colds and flus. The opposite is also true. If we have very low levels of cortisol, which can happen after extreme long-term stress, when we really, really burnt out, the relationship there is often more inflammation. So allergies, autoimmune diseases, eczemas, rashes, things like that can become more prominent on our health picture or health canvas. It's important also to recognize that when we're stressed in the long term, our mental health is going to change. Our mood is going to change. We are going to be far more vulnerable to things like anxiety, to things like depression, or even a whole bunch of shades in between. You know, we tend to talk about anxiety and depression and mental health, but there might just be melancholy. There might be flatness. We have a whole bunch of mood shades in between, but certainly stress can create a change in mental function that can affect us dramatically in our work and in our relationships. And this is simply because if we are so busy making cortisol to survive, to keep dealing with the onslaught of stress, we're not going to make these beautiful, lovely things called neurochemicals that we need to feel good. So you might know about some of these neurochemicals, things like serotonin, things like dopamine. Serotonin being more the chemical of, we think of it as the happy neurochemical, and that's one way of thinking about it, but it's actually more the neurochemical of balance. So we actually need it to concentrate. So if we think about work as well, we need neurochemical balance. We need good serotonin levels to focus at work and concentrate. And if we're stressed and our serotonin levels are low, our concentration is going to be affected as well as our mood. We also need really good levels of dopamine to perform well at work and to feel good in life. Dopamine is our neurochemical of drive and motivation. So when we are stressed in the long term and it's dysfunctional stress, there's a real change in the delicate neurochemistry of the brain, which can affect mood, motivation, and performance and bonding in our relationships. So understanding stress and how it impacts your health is vital, and it affects our health in many, many ways. The immunity of our body, the way our brains are wired and performed at work, and certainly how our female hormones behave and how balanced they are, which is what we're going to go into in a minute. And I love this quote. It says, "Your body is transforming. It's not betraying you. Trust it and let it lead you into your most resilient and stressed managed self." And I think the important message here is that, again, health is a landscape. It is ever changing. You know, what we experience today as good health may not be what good health is for us next year. What we experience today in terms of maybe my hormones are beautifully balanced today, maybe next year I'm in the throes of menopause. Things change, health changes. And we need to not only have insights, but navigation tools for all of these things so it doesn't feel crippling, especially for women going through times of hormonal transition like perimenopause and menopause. There is often this feeling of, my body's letting me down, it's betraying me, it's not making the hormones it used to make, or the stress I'm experiencing is getting the better of me. What have I done wrong that I don't have the tools to deal with it or cope with it? It's not that. It's just change. So we want to understand change, build resilience, and navigate differently. So let's chat female hormones for a little bit. So when we think of the major female hormones like estrogen and progesterone, most of us think about reproductive functions. We think about boobs and periods and vaginas and all of the stuff. And whilst these hormones do work and have really important functions in terms of all of that, and pregnancy as well, they actually have a role to play in female health in every single other tissue in your body. Maybe some of you know this, but for some of us who don't, this is quite a radical thing. Right now, if you're not menopausal and you're still making female hormones and you're a woman, your estrogen and progesterone are impacting every single tissue from your brain to your hair, to your joints, to your bones, to your teeth, to your eyes right now as you sit here. Phenomenal. They are so vital. But the insight here is, if this is the kind of role they play in female health, what happens to us when we start to lose these hormones? The changes can be radical. And if we don't understand how far-reaching these female hormones are, we may not understand when we're going through hormone decline, how a change in dental health might be linked to our hormones, a change in mental health, a change in digestion. And so we need to gain insights here. Now, female hormones in the brain. I just spent a minute telling you guys earlier how when we're chronically stressed, we can have changes in how we make vital neurochemicals that regulate mood, memory, behavior, and sleep. And I picked out serotonin and dopamine as being two major ones. And again, it comes up that actually our female hormones affect the very same neurochemicals. So the interesting thing here to note is that when female hormones start to decline, there is an impact on serotonin and dopamine levels. And when we are chronically stressed, there is an impact on serotonin and dopamine levels. And the big aha moment here is, if we're chronically stressed and we're going through hormonal change, there's a really, really, really potential big impact here on mental health concentration. So I really want every single woman today to be aware of this double whammy and to know that there are many things that can be done about it. One of the important neurochemicals in the brain as well is something called GABA. GABA is a calming neurochemical. It feels really good when we've got GABA. We can sleep well, we can manage anxiety, we can slow things down, we can make important decisions. And when we're really, really stressed and making tons of cortisol, we cannot make GABA in the brain. And similarly, when we're going through changes of the perimenopausal changes, particularly when progesterone levels decline, there's a drop in GABA. And women who are deficient in progesterone often experience more anxiety for no reason, night sweats and hair loss. So some of the very early symptoms of perimenopause, which we're going to get into in a minute, are actually around anxiety, poor sleep, hair loss, and night sweats, which a lot of women don't initially pinpoint as being related to hormone change. We often think, oh, well, maybe this is because I'm stressed, or maybe it's because my cat died, or maybe it's because, my child's struggling here. There are all sorts of reasons that can get us tangled up. And sometimes it's really important to detangle these things. It's also just really important to know that female hormones are critical, and there's so much research going on in this space. They are critical in protecting our brain cells as women. So as we lose them and as we age, there are real changes, real structural changes to the brain, which can affect how we make decisions, how we focus at work, and can really can affect our confidence, especially in the workplace as we're getting older. So some of these common symptoms could be a loss of verbal fluency. Women tell me all the time that they walk into a room and then they suddenly forget why they're there, or, just forgetting little things, or listening to content or information and feeling like it's just not landing, that it's sort of in and then out, and not being able to hold on to information. Scattered thinking, feeling of like a really busy brain, wired brain, a brain fog, a feeling of really foggy thinking that's not clear is really, really common. And then the mood and sleep changes that we spoke about. So these hormones are pretty important, right? They can affect our entire experience of ourselves. All right. So we all go through hormone change. We are all, as women, going to go through menopause. Menopause is the time where our ovaries stop working. They no longer make our estrogen and progesterone for us. And before we go into menopause, we are all going to go through this journey called perimenopause, which is really just the time before menopause where hormones start to change. They're not low, but they're changing. And I wanted to show you what some of those changes look like, because again, if you understand what to expect in your minds clearly, it just paves a new way for navigation. So this is such a beautiful picture because it kind of just shows the spectrum of our journey, the spectrum of our experience. And what it shows us is that when we're premenopausal, we'll call them just very normal, healthy, good levels of estrogen and progesterone. We're, if assuming our hormones are balanced, life feels pretty balanced from that point of view. And then when we start the perimenopausal journey, which is the blue part of the graph, you can see what a radical change there is compared to before. And then eventually at the end of the perimenopausal journey, we end up in menopause where hormone levels are just low. So let's understand this blue roller coaster journey that is perimenopause for a minute. And it really is a roller coaster. You can see that those estrogen levels are all over the place, up and down and up and down. She cannot decide, and it really does go like that. And women get lots of different symptoms when estrogen is high, and lots of other symptoms when estrogen is low. And in this way, the flux of estrogen during the perimenopause can really feel like a really disconcerting, where am I, what am I doing kind of experience. So I've lost you again. In the early parts of perimenopause, periods may still be normal. And this is why a lot of women don't even know that they're perimenopausal, because their periods are normal. Sometimes they're even heavier. And we're not prompted by our periods to think that we're in perimenopause. But remember that your female hormones affect every tissue in the body. So if we're only looking to our periods as clues, we might not pick up that we're in perimenopause. We need to think about mood symptoms, energy, skin, hair, sleep, all of these things that we've been discussing. So really commonly, as I said in the beginning, in early perimenopause is a change in mood, change in sleep, night sweats become quite common, and even a little bit of hair loss. As we progress deeper into the later stage of perimenopause, you'll see in the big red circle that even though estrogen is still very fluctuant and up and down, this hormone is following a downward pattern. So over time, our estrogen levels are getting lower and lower and lower, even though they're still bouncing around quite a lot. So a nice way to think of this is that you've got a whole pool of estrogen, and over time, that pool of estrogen is getting smaller and smaller. And some of the clues that you're now going through the later stages of perimenopause may be that periods do start changing at this stage specifically. They can become lighter. We can start skipping them. Hot flushes may begin. Dryness is a common one of the skin, hair, vaginal dryness, very common. Bladder irritability, needing to wee a lot, burning urine, infections, achy joints, huge impact. Estrogen and our joints, muscles, bones, intricately connected. So lots of women going through the transitional years have joint pain, get muscle loss, develop bone density loss, which we'll talk about later, and certainly lots of mood stuff as well. So if we look at the definition of, we spoke a bit about perimenopause, if we chat about menopause, the medical definition makes me chuckle a little bit because it goes something like this. It says, well, now the ovaries don't work. We don't make female hormones anymore. And you can say that you are definitely in menopause if you have not had a period for 12 months in a row and symptoms in that time. And all I just want to say to you ladies out there is please don't wait a year to count that you haven't had a period for 12 months to say, okay, now I'm in menopause and I can go and see my doctor and chat about treatment. No, we don't wait for 12 months to pass. So if you have any of the symptoms that we've chatted about and your periods are changing, say you've skipped 2 or 3 periods and you've got symptoms, go chat to your doctor. If your periods are normal and you've got symptoms, go chat to your doctor. There are tests that we can run to confirm whether you're perimenopausal or menopausal. Don't wait. But really, there's so much weight on the medical definition and the physical symptoms that go with perimenopause and menopause. And that's important because we're all different as women. Some of us go through this journey and we have really challenging, really severe symptoms, and other women just seem to cruise through it. There are no rules. Everyone is different. But there is a lot of focus on the physical changes, like the hot flushes or the mood issues or the concentration issues. And I just want us to remember that it's not just medical definitions that count. It's our own definitions and experiences of our health that count, that matter if we are going to be proactive about health. And this is a really vulnerable time for a lot of women because we are confronting so many other layers of ourselves, our identities, our lives at the same time. And what I see really commonly is women are facing issues around feeling disempowered or perhaps more helpless because they don't understand what's going on in their bodies, or they've got such terrible brain fog they can't concentrate well at work, and then they're freaking out about work performance and losing jobs and things like that. So it's about really being honest that this is a time of huge impact on every level for women, and we need to engage in all the layers of this transition, not just the physical, and build steps back toward empowerment. I cannot say this more loudly, clearly, or strongly. And that is, we're all going to ride this ride, ladies. It is inevitable, but we can ride it well. We don't need to be helpless. We don't need to be confused by a whole bunch of conflicting information. We really, really can be empowered, clear, purposeful, informed, and forge a very different health journey for ourselves. Okay. So just a couple of things to touch on is really going back to the physical changes of perimenopause and menopause. We've spoken about some of the symptoms that are overt or maybe obvious to you, like mood, sleep, hot flushes, things like that. What I also worry about as a practitioner when I'm seeing patients and dealing with patients, and what I'd like you to be aware of today, is there are lots of other changes that are happening inside your body that may be completely silent. So in other words, you may have no symptoms. And some of those changes, for example, are women who are transitioning get cholesterol levels that often shoot up, very vulnerable to insulin resistance, very vulnerable to weight gain, that dreaded belly fat that becomes a problem for a lot of us. Well, these are things that are really important. So I tell you about them today because you can't feel when your cholesterol's going up. There's no symptom, but you can know about it and you can ask your doctor to test your levels so that you can make sure that all these other areas of your health are being cared for. So when women are transitioning, we are more vulnerable to heart disease. When women are stressed, we are more vulnerable to heart disease. So again, this double whammy of stress and hormone change on health experience for women is profound. We've been through a lot of the symptoms, and I think I don't need to say it again, in that the experience of hormone change and decline on women, relationships, and in the workplace is profound, and it is not nearly getting the support and the attention that it deserves. If you feel safe, speak out, speak loudly, raise other women up with you in information and empowerment. We need to be talking about this, and we need to be addressing it differently. So we've mentioned a lot today about a whole bunch of different symptoms and different systems in the body because female hormones impact every single tissue in the body. And in this way, there is also a link. As hormone levels drop down really low when we become menopausal, we don't just get symptoms, we're actually more vulnerable to certain diseases. So in the picture I just showed you, we are aware now that we're more prone to heart disease, but we're also more prone to joint diseases, loss of bone density, so thinning bones. We don't love thinning bones because you may not think about this in your 30s and 40s, but if you have thin bones when you're in your 60s and 70s and you have a fall and you have a fracture, that can be debilitating and really, really affect quality of life going forward. So these are things we do need to think about 10 or 20 or 30 years before we have the actual problem. That's part of preventative care and certainly changes to the brain. So what do we do? How do we navigate this? It's an enormous, enormous topic, but the pearls and the nuts and the bolts that I'd really like to leave you with today are that, first of all, menopause should not just be managed in a medical or a physical way. There's got to be multiple levels of support from the physical, the medical, to the emotional, to the relational, to the occupational. It's all intertwined, really, really important. We're holistic beings, right? So we don't need to prove this concept. It's really well proven. Mind, body, environment, body, all of these forces have impact on health. So we need to be addressed in a holistic way. If we just zoom into the more physical management of menopause and hormone transition, I'd just like you guys to remember that there is a toolkit of options available. So it's like having a palette of different paint colors, and everybody needs sort of different colors to have the canvas of health that they want to create for themselves. But really, what we have at our disposal is we have MHT, which stands for menopause hormone therapies. We have medications that are not hormonal therapies, but they're pharmacological medications that we might use to control hot flashes or night sweats. There's some supplements. Supplements are a big topic on their own. If you're exploring supplements, just be aware that not all supplements are safe because they're natural. And be aware that some supplements can carry risks. So you've got to chat to someone who's in the know, preferably your physician, about all these things. And if you want to mix things like hormones and supplements, definitely run it through your doctor. Nutrition, good exercise, movement plans, weight resistance training to keep building muscle mass. As we age and we lose that muscle mass, our resistance training becomes important. That resistance training to preserve bone health, to stop our bones getting brittle, super important. And reaching out for support on all the other levels. So out of this little graph here, we've got all these tools sort of available to us, but not enough time to go into the detail of each. But I'm going to jump into the hormone therapies for just a little bit, because that's where most women have a lot of burning questions and they want to know. So hormone replacement therapy, HRT, is now called MHT. And it really replaces the hormones that become deficient in menopause. So we replace estrogen, we replace progesterone, our two female hormones, and sometimes we replace testosterone. Not always, because not all menopausal women are low in testosterone. But if we are low, we may replace that. And the most vital thing that I can tell you about hormone replacement today is that the safety of it really depends on the type of hormone and the way that you're using it. So just broadly, the type of hormones we can get, you can either get natural hormones that are, we call them body identical hormones. They're the same as the estrogen and progesterone that your body has always made your whole life. Or you can get synthetic hormones, which are altered a little bit in their structure, so they don't look exactly the same as your natural hormones. And there are pros and cons to both. That's a whole big discussion. But all I want you to know about is there are different kinds of hormones. Ask your practitioner what you're getting, because the side effects will change depending on what hormones you get. And the side effects and the risks will change depending on how you use your hormones. So if some of you are at the stage of life already or know people who are, you may see moms or sisters or friends sort of rubbing these hormone creams on. And that is because if we use estrogen on the skin, for example, as opposed to a tablet that we swallow, we know that this is a safer route of using it because we are less likely to get clotting problems if we use it on the skin, and far more likely to get clotting problems if we take it orally. So there are changes in how hormones work depending on the type and the route at which you use hormones. When we have the discussion with patients about whether to use hormones or not, so here's my belief around this. When every woman reaches menopause, every woman should have the right to discuss fully the benefits and the risks of hormone replacement therapy and to fully understand it before a decision is made whether to use it or not. And when the decision is taken to use it or not, that decision needs to be respected. So the importance of this is that a lot of women don't take hormone therapy because they're misinformed about the risks. there is unfortunately a very, very old stigma that we have that hormones are going to give us breast cancer and don't take them. And I really want us to just understand today that the science has evolved so, so much over the last 20 years. And the risk that we thought hormones carried for breast cancer 20 years ago is not the same today. It's much, much, much lower. And in fact, when we look at the science and we look at the benefits, a lot of the science will show us that the benefits around the heart, around muscles, joints, mental health, quality of life, outweigh the small risk of breast cancer. So I'm not saying that they're risk-free, but I'm just saying that we need to be aware as women to not buy into old stigmas and myths, that we need to really be acquainted with the science and good information. And it really is a case of understanding what the benefits look like for you and what the risks look like, and making sure always, always, always that there's more benefit to you than risk. And that is the job of your doctor, is to go through that with you. Every woman in her own right is very, very individualized. So I'm giving you this information in quite a generalized way, but you must understand that you need to take it to your practitioner and talk about your benefits and your risks specifically, because they will change from woman to woman. But I would encourage all of you, every single one, to at least have the discussion, have the dialogue. If you decline hormone therapy, know why you're declining it. Understand then that maybe you won't get the heart protection that hormone therapy can potentially provide for some women. And if that's the case, then make another plan. Discuss with your doctor, well, how else can I then protect my heart? What should I be looking at in my diet, in my exercise regime? Are there supplements that I can take, like an omega-3, that might benefit me? So it's having appropriate discussions. Hormone imbalance is not a flaw, it's a signal. So we spoke about paying attention to messages. I love this so, 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 so much. I am listening, I am caring, and I'm healing with compassion. I think that's really what it's all about, is to not forget to tune in and listen. And just to, perhaps maybe end with a note around linking it back to stress. Part of our stress culture is there's a harshness to it, right? So it's deadline driven and it's task driven and it's perfectionistic. And we're human at the end of the day. We're humans in these very human bodies. And if there's one thing I could tell you, the greatest insight I've learned after 14 years of practice is that every human body needs rest and pleasure. And, we forget that so, so, so quickly. And especially when we get embroiled up in stress and performance, the first two things that often go are rest and pleasure. So please remember that we need those to be healthy as well. And I hope so much that today has just planted some ideas, seeds, thoughts to discuss with your practitioners or your health teams on your journeys going forward. And if not, if anything, just to listen and to practice more compassion and care. Thank you very, very much for your time.
Thank you very much. That was super, super informative. Um, so I think it's over to some questions. We've got one that has been typed in the chat, which is what level of hormones will be normal if you're using HRT?
Oh, that's such a great question. Okay, so blood testing for hormone balance is not a perfect science. We do it. So I do test blood levels in patients who are on HRT or patients who are not on HRT to try and understand what their hormone levels are. But it's not a perfect science, because your hormones don't just act in your blood, they act in your tissue, and we can't test the tissue. We can just get a blood sample, which is a very limited peek into the whole picture. So I would say to this lady is don't aim for perfect blood tests. Don't have a goal blood test parameter that you're aiming for. What we're aiming for always is a happy woman. That's number one. So if you're not flushing, if you're feeling like your mood is great, your sleep is great, you've got good quality of life, there's no sexual health issues, then we're generally happy. We do sometimes look more closely at a blood test called FSH, which is made in the brain. It's a better barometer of a woman's estrogen pool. So remember that picture I showed you where estrogen levels can fluctuate in perimenopause. When we're on hormone replacement and we're putting hormones back in the body, they can also be a bit inconsistent. So looking at the FSH is a better test if you're going to test. And always, always, always your symptoms. Symptoms first, blood second would be my feedback there. Other questions?
Thank you, doctor. It says here, which level of FSH is suitable for reproductive age?
That's a good question. Yeah. Okay. So your FSH will change. So now we're going to a reproductive age. So this is a woman who is not yet peri or menopausal. And in women who are of reproductive age, there is the normal female cycle, the normal menstrual cycle. And that cycle has its own particular rhythm of hormones. So your estrogen and progesterone and your FSH will change slightly within that cycle. So to answer your question, there would be different normal levels at different times in your cycle. If you want to test, we recommend a day 21 blood test, and then we look at what FSH levels are normal for that time of the cycle. But generally, women who are producing good levels of estrogen, who are of reproductive age, have got FSH levels of typically around 5, so definitely less than 10. If a woman is starting to show signs of deficiency, like in perimenopause, we'll get higher and higher levels. So we'll get an FSH that might jump to 15 or 20. When a woman is definitely menopausal and there's no estrogen left, FSH is going to jump to above 30 or 40. Most of the time in my patients who are menopausal, before they've had any hormone replacement, their FSH levels are between 60 and 100. So there's a whole spectrum, and that FSH just gets higher. Yeah.
So the other one is, said you kindly outline again some of the natural things we can do to have hormonal balance.
It's a great question. So if we're just jumping into the world of natural options for me would include supplements as one sort of tier, and then lifestyle treatments, so exercise, diet, etc. And those lifestyle factors are super, super important. I cannot stress them enough. They've really been well researched and backed by good science. But I'm assuming you're asking more in terms of the supplement space. It's difficult for me to make general recommendations on supplements, but I'd rather direct you to maybe think about them as sort of two branches. One, supplements that directly balance female hormones or could directly balance female hormones. And there are lots of those. So one of the most popular ones is something called chasteberry. A lot of women use them when they're perimenopausal, and it just balances that estrogen progesterone level. You've got to always be very, very judicious and careful about supplements because, as I said earlier, they're not all safe and they shouldn't just be considered so. So please do run it by any healthcare professional. And then there's some after menopause that have been used to control flushing. And some of them are effective, but they tend to be effective for quite a short time. And just remember, any herbal supplement that helps women with flushing after menopause is not going to do the other things that hormone replacement would do. So a herbal supplement is not going to protect your heart, for example. It's not going to build your bone density back up. So again, just be very clear when you're choosing what route you're going to explore, that you're not inadvertently self-sabotaging yourself by using a supplement because it's safer and you're not getting the benefits that you might get from hormones. And then the second part to that I'll just quickly mention is not directly affecting female hormones, but just general health for women who are transitioning. Think of the three things you can't get from food, from a really good balanced diet, which would be omega-3s, really important for inflammation, probiotics, brilliant for gut health, obviously, vitamin D. So always a good idea to have a vitamin D level checked, so critical for bone health. And if deficient, we do need to supplement for those things. And most people today, because of stress and nutrient deficiency, do quite well with a bit of magnesium at night for sleep. So those would be some sort of real basics that you could start with to get you going.
So another question here is, if I'm unable to pinpoint perimenopausal symptoms, can I just go to see my doctor or ask for a test?
Yeah, absolutely.
And
And
ask
please
for a test.
do. Yeah, definitely. I'd have a conversation with your doctor where you can, and like I said, it sometimes feels like a tangled mess where is it perimenopause? Is it stress? Are my night sweats because my hormones are changing, or because I've got malaria or an infection, or maybe it's a new down duvet? Like, what's going on? Go and like explore it. Health is an exploration. It should be untangled and explored so that you get answers. And part of that exploration is doing the correct blood tests to give you those answers. So we should be able to tell you quite easily, based on your symptoms and based on two blood tests, whether you're perimenopausal or not. And those two blood tests to ask for would be one, that FSH level that we spoke about, and number two, the second test to ask for is something called anti-Müllerian hormone, AMH. And that tests a woman's, the number of follicles left in a woman's ovaries. So we call this a test of ovarian reserve. How much fuel is left in those ovaries? How much is left in that tank? So we can tell quite easily. So go ask for those tests, definitely.
I have another question. How do you combat fatigue? I also have a chronic condition that causes fatigue. Will HRT relieve some of the fatigue?
It's a great question. I see this a lot in my kind of practice because I see a lot of complex patients, not just menopause, chronic fatigue, fibromyalgia, etc. It's a really interesting interface. So the first part of your question, which is what causes fatigue, my answer is so many things, and they need to be worked up. So I'm going to leave that there. But your question around will hormone therapy help my fatigue? It may. It also may not. But I will tell you that there is a lot of interesting overlap between cellular fatigue, inflammation, which causes fatigue, pain, which can cause fatigue, and hormone messengers and hormone signaling. So in many cases that I've seen, there has been relief, and in some cases not. But it's worth an exploration.
Another question, can flexible hours reduce adrenaline and cortisol spikes?
It's a great question. It's a loaded question.
If you ever heard one.
I think the answer to that is that there's no answer to that. I think we got to dive a whole lot deeper. The answer to chronic stress dysregulation is not so simple, unfortunately, and is more a case of creating a bouquet of solutions, right? Like there's diversity. We need lots of different solutions. And again, it's really individualized. You can't take a stress management plan and necessarily apply the same plan to everybody because we all wired so differently. For example, for one person, playing a beautiful, gentle piece of music can really help lower their cortisol levels. And for another person, it can feel like someone scratching on chalk and really raise their cortisol levels, you know. It's really, really individualized. But when it comes to stress management, I think the place to start is to again go inward and just start yourself at home and make a list. What makes me feel good? What really aggravates my stress? You know, and start to understand yourself better first. And then when you've got that, you've got a starting point.
Another question, probably I missed this. Why would a woman need testosterone?
Oh, that's such a good, it's my favorite question. We do. We need it, ladies. We really, really need it. We need testosterone. It's an important hormone in women. We have less of it than men. And conversely, men have less estrogen than women, but men still need a little bit of estrogen and women still need a little bit of testosterone. And we need it because it helps us think clearly. It helps our mood as well, and it helps us build muscle mass and bone density. And it's a really important regulator of libido, desire, sexual function. So at the moment, the South African guidelines for using testosterone are you can use it if you're postmenopausal. You can't use it as a premenopausal woman. There's a reason for that. I won't go into it. So you need to be postmenopausal. If you've got any issues with libido and your levels are low, you can use it. And I must say, for me, in my experience, and I've been working with testosterone for many, many, many years, for women who need it, where it's given responsibly and correctly, it can make a tremendous, tremendous difference. So if you have not yet been tested for low testosterone, it's really something to raise with your doctors. Absolutely. And it's gaining far more traction now in the medical world. So what I'm saying is if you're menopausal and you haven't been tested previously, raise it with your doctor because doctors are learning new things about menopause now more than ever on a daily basis. So what your doctor knew 2 years ago might be different today. So ask the questions, definitely.
Another question is, what about PCOS? What are their symptoms, and does it make someone lose her hair, and how to remediate to it naturally?
Oh, yeah, that's lovely. So PCOS for me, as you guys know, I'm more of an integrative, so I do use quite a lot of lifestyle nutritional supplement approaches where they work well. And PCOS for me is one of the conditions where they really, really can work well. So it's a great example of when to use an integrative model of care. Um, the answer to that is it's quite a long, there's a whole algorithm that we work with. So yes, it can cause hair loss. It can cause irregular periods or no periods. It can be linked to infertility. It is associated often with inflammation, with an unhealthy gut. It is often associated with stress. So if I look at PCOS, um, in younger women, there always links to stress and poor gut health or inflammation. That's the bigger matrix. So we've learned that stress affects female hormones, gut health and inflammation also affects them, and that perfect storm is really seen in PCOS. So we would, again, they're blood tests that we can do. We look at symptoms, and the management should just be really holistic. We should be looking to restore normal female hormone balance between estrogen and progesterone. We should be trying to and get a woman's body to ovulate again. We should be managing any male hormones that are high. So often in PCOS, male hormones look really high, and women can get acne or hair loss or hair growth in other places that we might not want it. So we want to address that. And we certainly want to bring a lot of gut work, nutritional work. A lot of PCOS women carry weight. It's quite devastating, and it's by no fault of their own. Their whole chemistry is sort of geared towards more weight gain. So we really want to address that for patients. And there's a whole variety of tools that we would bring in to do that. So it's a map. It's a mind map of holistic treatment that works beautifully in PCOS.
That's excellent. Thank you for that. Then would you suggest we start visiting endocrinologists to avoid impact of hormonal imbalance? One feels silly talking to a GP about symptoms and what they give don't address the issues.
So great question. I hear that, and it's I think for me one of it's heartbreaking for me actually that we so often go to healthcare providers and we're not heard in our entirety because they're rushed or they're busy or and I've just said to you, tease it out, explore it. You know, health is this journey. How many of us go to our healthcare providers and get an hour of time and the ear to tease all of these things out? And it makes me sad because I really feel that is what medicine should be. And all I can say to you is once you've decided how you want to navigate your health journey, if it is in more detail, if it is in more of a proactive, preventative, holistic way, that requires time. You're not going to get that from necessarily your local GP who does 15 minutes. So research and find your person. You know, health is a partnership, and there are practitioners out there. You just need to find your fit. It's not going to also always be in the form of an endocrinologist because not all endocrinologists are integrative and see the bigger picture. So there's sometimes value in seeing various medical specialists to get sort of bits of information that are useful or medical management that's useful. And then there's also a time where maybe you want to work with someone who's looking at the bigger picture and connecting dots for you. So I would just encourage you to really just do your research and find your team or your person and take it from there.
The next question is, do men go through something like menopause in terms of the effects of their hormone on their health? If
Yeah.
no, does menopause not affect careers of women in that they may not be taken for certain roles if menopausal?
It's a great question. I don't know, and it would be interesting to study the impact of that. All I can say is that I definitely have seen from my experience that women in the workplace can struggle with hormone change and transition because it can affect so many areas of health and life. And again, why spaces like this are so critical to understand better, to ask for help, to speak out early, to get information. Men actually do go through their own kind of menopause, and men go through testosterone decline. So they lose testosterone levels with age as well, and it can hugely impact quality of life, decision making, mood, sexual health as well. And again, I feel it's another really important topic. You know, men in the workplace who are going through testosterone change also go through major shifts that should be addressed as well. So yeah, they do. And then they have to also deal with us, and we have to deal with them as we're all going through hormonal madness. Lots of fun.
I've got a thing here. What about fenugreek? I heard that it helps balance hormonal balance. Is it safe to consume it daily?
So I would never say that a supplement is safe for every single person on the planet. Supplements, like medicines, have benefits and risks, and they've got to be tailored to the individual. So I would, again, just sort of, I don't obviously don't know you and don't know who I'm speaking to, but I'm well aware of fenugreek as a supplement, and it may have potential benefit in terms of libido, particularly, and possibly hormonal balance. But in my experience, this is just my opinion, this is not the literature, not quoting the literature. I think there are other herbals that are better for hormone balance specifically than fenugreek. That would be my opinion.
Then there's a question. Is it true that red meat and dairy products can increase hormonal imbalance?
Indirectly, yes, because remember, all systems of the body are connected. And what we didn't talk a lot about today is the link between gut health and hormone balance. And there's a direct link there. The more unhealthy your gut is, and the more inflamed you are, the more likely you are to have imbalance between estrogen and progesterone. So If we bring that back to certain foods like dairy and red meat, which may lead to more inflammation, gut inflammation, that can offset a kind of hormone imbalance. But it's just worth saying that dairy and red meat don't necessarily mean inflammation for everybody. Again, it depends what the state of gut health is, but the potential is there, absolutely. And more importantly, I think if one can focus on nutrition, if you can't get to your doctor, what can you do today after this lecture? You can certainly start looking at your nutrition as a first step. And we know that basics like making sure you get enough fiber, eating enough good, clean protein, and getting loads of nutrients in through your veggies and so forth is really, really helpful for hormone balance.
Okay. Says here, I was diagnosed with PCOS, insulin resistance in my early 20s. Supplements were the solution the doctor offered, but I recently started using adhesives and I've seen more improvement in my PCOS symptoms than when I was just taking supplements. Does this mean hormones are the best solution for this case? If not, what is the recommendation knowing that maternity is a dream one day?
So just I need clarity on what adhesives. I'm not sure I understand that part. So maybe
I,
she can just type in. Yeah.
yeah, I don't know.
So I can't answer your question fully because I don't know exactly what adhesives you're on, but maybe just a quick point on that is PCOS is a spectrum of again, it manifests differently for so many women, and some women have it mildly, and some women have it quite severely. And in such a way, when we offer treatment plans, for some women, a supplement treatment plan might be too gentle, might not work. And you might be one of those where you needed more medical interventions. And the converse can be true. Sometimes for very mild cases, supplement work can work beautifully. So again, I'll just come back to this point of it should never be a case of supplements or medication. Integrative care is the ability to integrate the best of all worlds, but most importantly, to be able to know when is the most appropriate to do what. And this is something that I have to think about every day in the work that I do. I have to think about, well, does this patient need medication? Are things quite far down the line? Or are they going to be safe on a supplement? Or maybe a supplement is actually safer for this patient because what they have is quite mild and this really heavy medication is, maybe a bit of an overkill for them. So it's not cast in stone. These are nuances and decisions that we're making all the time. But that sounds reasonable. That something other than supplements may have been your solution.
It says here, what can be the causes of cysts constantly growing in the womb? Can it be the diet? Can it be hereditary? And what can one do naturally to reduce them apart from surgery?
There can be many causes of cysts in the uterus. One of the causes can be female hormone imbalance. So if we just go back to the idea of estrogen and progesterone being like yin and yang, right? We feel good as women and we're healthy when they're in balance with each other. When we go through periods where that balance is lost, particularly where estrogen is more dominant and progesterone is deficient, like in perimenopause, estrogen tends to overshadow. That's a good word. It overshadows progesterone. This is the time where we can get things like cysts more frequently, fibroids, etc. And it's because estrogen it's a growth hormone, so it tends to cause growth of these things. So again, treatment strategies, sometimes we just need surgical removal, but underneath all of that, one would need to work with a practitioner on the bigger picture, so to speak, getting those estrogen, progesterone levels in balance, looking at inflammation, looking at all these different parts to health and getting them in balance.
And then the last question is, does your center offer online consultations? Yours, they're talking to you.
Yay! We do. Well, look, we as doctors, we have a requirement to see you once a year in person. Other than that, we can do online consultations, and we do. So that's a start, and we can navigate that as we go. Absolutely.
Great, great. Do you want to share somewhere here a link or something where people can get hold of you?
What you can do is you can also find me on Instagram, Dr. Simone Silva. It's so my Instagram is just information. That's all it is. So you'll just get tidbits of information which might be helpful. And then there's an email address here if you'd like to book an appointment. And then we have a website as well, hormonalhealth.co.za. All right.
Brilliant, brilliant. Thank you, everybody. We've had a lot of questions saying, would these tests be covered by the Holiday Health policy? Would the medication, the hormonal medication that's prescribed by a doctor be covered by the policy? The good news is all of these things are covered by your policy when prescribed by your doctor. So I can only say from personal experience, I think I left it too long. I should have started sooner.
It's never too late, just by the way. I'm just saying.
It's never too late. So it was great. So I started and I was like, why did I wait so long? I just feel so much better. So if you are in that conundrum, I'm a personal reference for don't put it off if you are struggling. It's not worth it. But obviously speak to your doctor. So thank you, everybody. Thank you for joining us. Thank you for spending this time with us. And we look forward to seeing you at our next webinar. Watch your emails. They will keep coming from the same email, and we will share additional topics of interest to you. Thank you very much. Have a lovely day. Thank you. Bye.